Hi, Sarah.
Hi, Dr. Fleischer.
So, we are here again with another episode of Rush Recaps. This is our series of short educational videos intended to help address some of the common questions and concerns that we hear often from our patients, our care partners, and families. This project is supported through the Parkinson's Foundation and research support from the National Institutes on Health. Sarah, something that I still maybe am a little bit confused on, and I know I get questions a lot from our patients and families, is the difference between Medicare and Medicaid. Can you please help us understand? And the parts, there's like and I don't understand all of this. Can you walk us through what is Medicare? What is Medicaid? How do we get enrolled if we need to help?
Yeah, this is another really complex topic, and it doesn't help again that the names are so close together. So, Medicare is the federally funded health insurance program for seniors over the age of 65 or adults with disabilities who are receiving Social Security disability. Medicaid is the state funded health insurance programs for lower income individuals or individuals with intellectual or other types of forms of disability. Medicaid is a state by state program. So each state gets to design the rules and set up their health insurance programs a little bit differently. So there is no one size fits all for Medicaid, and you would need to speak with your state specific Medicaid office to learn more about eligibility for the programs and the process for applying. But that application process for Medicaid is handled by each individual state, and you would apply with them, and if they would then identify what's covered, where you would need to go for coverage, and who you can see with those programs.
So, Sarah, if,
Um,
for example, if I was a Medicaid recipient and living here in Illinois and decided I would like to move someplace warmer and be closer to family, right? And I
mhm.
moved to Arizona or to California, would my Illinois Medicaid somehow carry over to one of those states? Would the Illinois Medicaid folks be able to help, or I have to go and start from scratch in the new state that I'm moving to?
That's a great question. You unfortunately would need to start over in the state where you will be moving to. And most often there's a residency requirement. So you usually have to be in the new state in order to apply. Usually that residency requirement is something like 30 days, and you need to have a bill or something in your name with your new address to be able to apply for benefits in the different state. And often you need to show proof that your insurance coverage has been terminated in the previous state. So it's a little bit of a process. It's very doable, but it's not quite as simple as transferring
Making up
from one
anything.
state to the next state.
I feel like we need one of those news banners scrolling across the bottom of the video that says, "Do not send us emails. Sarah did not come up with these rules. Please contact your state and local representatives." Okay, so that's what happens. But if you have Medicare, for example, and you move from one state to another, do you have to do anything about your Medicare coverage? Or if you're a snowbird and you go from one place to another?
That's a great question. And the answer is it depends. So there are Medicare is that federally funded health insurance program for people over the age of 65 or individuals with disabilities who are receiving benefits through Social Security disability. And so if you have traditional Medicare, which I used to be able to say, does your Medicare insurance card have the red, white, and blue at the top of your card? I don't know that necessarily, they've changed all your cards lately, so I can't say that's exactly the same. But a traditional Medicare, you'll have Medicare Part A, which is your hospital benefit, Medicare Part B, which is your outpatient benefit. If you have that program, it works in all 50 states in the US. You will most likely have or may have a supplemental insurance plan to help cover a portion of the cost of healthcare that's not covered by your Medicare. Those will also generally work anywhere in the US. And if you go from, Illinois to Florida or Arizona in the winter, that same policies you wouldn't necessarily have to make any changes to.
Okay. That's super.
Now, that there is another kind of Medicare called Medicare Advantage plans. And those bundle your Medicare Part A, your Medicare Part B, and your supplemental plan together. And they're managed by an insurance company. So you might see commercials on TV for like the AARP Medicare Advantage plan. And then in small print says like managed by United Healthcare or Humana Medical, or fill in the commercial insurance company
So is
here.
it some kind of a hybrid between Medicare by the government and then we'll give you those same benefits, but we're doing it through a private insurance company?
Exactly. That's a great way to describe it. And those are geographic specific. So if you live in Illinois, you might be eligible for certain Medicare Advantage plans that someone might live in Arizona would have a different set of Medicare Advantage plans that they're eligible for because of geography and other things that are beyond my pay grade or understanding. But so if you move, you are eligible for a special enrollment period. And if you change geographic locations, if you move from Illinois to Arizona, you have a period of time where you can change your Medicare Advantage plan to a different plan so that you'll still have access to coverage. Now, that being said, if you're traveling, let's say you're in Illinois visiting family and you go to Arizona and you need to refill a prescription, or maybe you're not feeling well and you need to be seen by urgent care, there's generally ways where you could go see an urgent care physician. Or if you had an emergency and you had to go to the hospital, you would be able to receive care in the emergency room. It's more of that long-term continued follow-up routine care where you're going to run into issues and where if you move, you're going to need to make changes to your plan.
Got it. So how do you apply for either Medicaid or Medicare?
So Medicaid, you're going to need to apply with your specific state's Medicaid program. And usually you can find that by Googling or visiting kind of your state Department of Human Services office, and they'll be able to help direct you to how to apply for Medicaid. For Medicare, you can apply online through the Medicare.gov website. You can call someone over the phone, or you can go into your local Social Security Administration office and you can apply for Medicare there as well. Usually when you initially become eligible for Medicare, you have an enrollment period of 3 months prior to the month when you become eligible, the month of, and 3 months after. So
And
if
that's the month of your 65th birthday?
It's the month of your 65th birthday. And so if your birthday is in December, you have September, October, and November. 3 months ahead, you have the month of December, and then you have the 3 months after, January, February, March. Easy for me to do that math. Or if you're on Social Security disability and you have waited the 24-month waiting period and you get to your eligibility month, the same rules apply. 3 months before, the month of your eligibility date, and 3 months after. This is a very, very simplified explanation of Medicare. If you have questions, you can go to the Medicare.gov website. There's a program called the Senior Health Insurance Program, or SHIP. And their information is also available on the Medicare.gov website, where you can go and find a local counselor who's trained specifically in Medicare and helping you navigate the Medicare benefits. They don't work for health insurance companies, and they can help you better understand what benefits might make the most sense for you for your individual situation, since everyone's situation is so unique. But hopefully that at least gives you an overview. I know it's really complicated, so continue to ask questions. go to the local Social Security office, call the 1-800 number. They're there to help you navigate the system.
Thank you so much, Sarah, for helping us navigate all of this and understand sort of this ABCs of Medicare parts and Medicaid. And I really appreciate it. So thank you all for tuning in and watching this episode. Please check out our other Rush recaps for more on this topic, as well as other frequently asked questions that we get. And if you want more, continue to explore that growing library of content on our Movement Disorders patient support page. Thank you so much, Sarah. Thank you all for watching. We'll see you in
Have,
another video.
have a good day.